This is Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. On the show, you'll hear from innovators in the food space. We'll have disruptive conversations with people from around the globe who are taking the lead on topics like food sustainability, ending world hunger, food security, and so much more. I'm your host, Paul Newnham. In today's episode, I'm joined in Geneva by Dr Kemel Ghotme. Dr. Kemel is a Colombian paediatric neurosurgeon and one of the people behind the 2023 World Health Assembly resolution on food fortification. You'll hear about how a paediatric neurosurgeon comes to spend his career advocating in global health policy rooms, the story of the first neurosurgery-led resolution in the history of the World Health Organization, and what it actually takes to turn a global resolution into food on plates around the world. Let's get into it. Well, welcome to the show.
Thank you, Paul. Thank you for inviting me.
It's absolutely my pleasure. So, Dr. Kemel, it's great to be in Geneva now with you this week and to have you on the podcast. What's going on in Geneva this week?
The World Health Assembly, and for me and my team, it's a major landmark because it's marking the third year since we got a resolution passed at the WHO, the World Health Assembly, to save thousands of children from having a devastating but preventable condition, which is the neural tube defect. Some defect that affect the brain and spine when the baby is developing, and it can be a major cause of disability and disease for many people around the world. And this is preventable, so we are celebrating the third year of having that resolution passed, and now we are listening to the member states of the UN explaining what is the progress that they have accomplished to implement and adopt this resolution.
It's so great to hear about that, and we'll dive into it a little bit more. You've got a unique background. You're both a surgeon as well as involved in global policy. Can you tell us a little bit about the story of how a doctor finds themselves working with the government of Colombia as you do?
That's right, Paul. So as a pediatric neurosurgeon, I actually have the opportunity to follow up the patients that I operate very early on their lives. Despite successful surgeries, I can see the challenges they face throughout their lifetime, just from a place of empathy with what the struggles they have in life, because they have to be hospitalized many times. They face challenges to achieve a fulfilling education or a satisfactory work or even relationship with their peers. So thinking that when you make a perfect surgery, you are impacting a child's life and probably their families. But I was always trying to find a way to impact more systemically outside the OR, outside the hospital. That's why it inspired me, precisely my patients. And working on prevention doesn't imply that we are leaving them out of a quality human and person-centered care. It's quite the opposite. They inspire us to find better ways to take care and to prevent everything that is preventable, and then reorient the resources for those cases that are not so preventable and will need our efforts, knowledge, technology, and resources.
So for people listening who might not know what micronutrient deficiencies are, how would you explain that?
It's called the hidden hunger. So even though someone can get a proper amount of food, the quality of that food needs to include vitamins and minerals to make every part of your body to work, to function well. Micronutrients include vitamin B9, for instance, which is what we call folic acid or folate, and that's necessary for a baby to have a healthy development after conception. If there is a deficiency in that micronutrient or even an insufficiency, things can go wrong and can go wrong very early. And same thing with iron. Anemia is a major problem throughout the world. Same thing with zinc. Gastrointestinal problems come from a zinc deficiency. And still nowadays, vitamin A deficiency is a major cause of blindness in different places of the world, and so on and so on. So micronutrient deficiencies is a major problem. I think thousands of people are affected by that, and it's very easy to fix, and it's very inexpensive to fix. The main issue is that those making decisions do not know two things. One, that this is a major public health problem, and second, that it's in their hands to take action to fix it.
And so when it comes to neurosurgery, why does this matter? Because obviously you're treating things in neurosurgery, but this seems preventative. So talk to me a little bit about how this connects.
So as surgeons, we could be advocating for having more MRI machines, or we can advocate for sophisticated ORs and having technical supplies and equipment. But that's not what's killing more people. That's not what most of the people need. They have to have a healthy start of their lives, and when they're grown-ups, they need to be productive, and they need to take care of their families and be a productive part of society, but they cannot do it if they're sick. So that's why we had these initiatives. It's a great team effort, and I want to also use this example to answer that question, Paul, and it is the International Federation for Spina Bifida and Hydrocephalus is an association of patients living with spina bifida and their families. They live with the condition. Why would they work on prevention? They need more support for assisted technology or treatments or rehab, but they were advocating with us for primary prevention, and that was incredible. And I said, we won't stop advocating until we'll have the last case, and that was very inspiring to me.
No, I think that prevention is so critical, and you mentioned it's also very affordable to prevent, and whereas I'm sure surgery is not so affordable for everyone.
Well, that's another aspect of the world that I'm advocating for, is that everyone worldwide have the right to have timely, affordable, and safe and quality surgical procedures when they need it. That's something that we are advocating for too in this World Health Assembly. And that's another aspect of that. But if we can prevent the cases that are avoidable with very simple public policy measures, then we can reorient the efforts and knowledge and resources to those conditions that are not so preventable.
Obviously, you can't breach any confidentiality, but is there a patient or a moment in the operating theatre that stayed with you? Maybe that's something that shaped you to take this fight on.
I wouldn't point out one single case, but it's all of them. They are very inspiring, especially children. As a pediatric neurosurgeon, my little patients are incredible, and they are an example of resilience, of strength, and also of positivity in facing the world. And their challenges do not define them. Their disabilities do not define them. What defines them is the strength to move forward despite the limitations. That's exactly what I think is the core of the inspiration to do the work that we do.
So you've had this incredible advocacy win on fortification 3 years ago. This was the first neurosurgery-led resolution in the entire history of the World Health Organization. How did you end up building the community around you, the coalition that really helped get that through?
So I want to emphasize that it was a team effort, and it came from different places. So in the US, GAPSBIF, the Global Alliance for Prevention of Spina Bifida, started making a call to action to the neurosurgical community. In the meantime, I was doing my doctoral research at George Washington University in devising a knowledge transfer toolkit to get the knowledge to the decision makers in Latin America. The International Federation for Spina Bifida and Hydrocephalus were advocating from the patients and families side. So we had also civil society and the scientific community, some governments taking action too. So with the result of my doctoral research, which was exactly how to overcome the barriers and how to leverage the facilitators to get that knowledge. So we've known that folate, the normal concentration of folate prevents 80% of the neural tube defects and other conditions such as cleft lip and palate, and also some cardiac malformations. We knew that from more than 30 years, but countries were not implementing that. So using translational science, which is the field of my PhD, we devised a strategy and a toolkit so we could convey the message to policymakers, starting with Latin America. And of course, I had to start with my own country, Colombia. So with this toolkit, I approached my Ministry of Health and their officers, and I explained that, and they say, why are not we doing this already? So they started changing the national policy, but then at that point, Colombia was part of the board of the executive board of WHO. Then we realized, why don't we take this to the next level and we bring it to the WHO so more countries can benefit from this. And that's how we started. So with the Ministry of Health, the Ministry of Foreign Affairs, and the support of GAPS Beef and all of the other organizations, we took this to the WHO. It was a whole process implying science diplomacy, multilateral conversations, the support of NGOs such as GAIN and Micronutrient Forum. So it ended up in the World Health Assembly at large in May 2023, and it was adopted unanimously. There were no objections, basically, because this is a public policy that is similar to vaccines in the sense it's very safe because there are no adverse effects related to fortifying food with the recommended concentrations. It's very practical because people don't have to change their behavior and start taking pills if they don't think they need them. It's very inexpensive because fortifying 1 metric ton of wheat flour, for instance, costs $6. And it saves millions in resources and thousands of lives. It helps countries in achieving the Sustainable Development Goals. For instance, zero hunger, because we mentioned that micronutrient deficiencies is the hidden hunger. Also improving health and well-being, and also reducing inequities.
So going back to the time when the negotiations were going, was there a moment that you were thinking maybe this resolution wasn't going to work?
There were some tense moments. And one of those was getting allies for sponsoring the resolution before the executive board of WHO. So in the process, you start with the proposal, the member state makes the proposal, that state works in getting allied countries to sponsor the draft resolution. And then you will get that as an agenda item for the executive board meeting. And if it gets approved there, then it goes to the assembly. So there was a moment in which the European Union was not so sure about sponsoring this or even accepting it, because it seems like a third world problem, but it's actually not, for many reasons. One is that, for instance, many countries in Europe have a Mediterranean diet, which is actually protective for congenital malformations, but the young generations are not having a Mediterranean diet anymore. They have a more Americanized diet in which fast food is predominating. So young women of reproductive age are not actually being protected with those diets. Also, we have a large mass of immigrating people that do not have access to quality food or fortified food in general. And also the statistics they measure count only the living births with the congenital defects, but many die in the process and they are not counted in the statistics. So the actual prevention happens when you prevent all cases. So with the scientific discussion, we were able to make them realize that it was actually also a high-income country problem, not only a low and middle-income country problem. And the other thing that they were saying is that they promote consumer's choice. So if you want to go to the supermarket and you need to be able to choose what you eat, but we convey the message that for more than 3/4 of the world population, it's not about consumer's choice. It's about what they get. They get what they have, is staple food. And usually the staple food is not enriched with vitamins and minerals. So at the end of that process, and also one lesson learned there was the humility to know when it's not about the science anymore. So as a scientist, you have to know when to step aside and be ready for to advise or to provide scientific counseling. But at some point, it's about the politics and about the diplomatic conversations. Yes. And at the end of that hard moment that we were thinking that this was not going to progress, the European Union not only accepted the resolution, but they were full sponsors of it. Amazing. Before the executive board. So it was 27 countries at the same time supporting the resolution that Colombia was proposing. And then we had some other countries, for a total of 35, participating and advocating for that. And it was approved at the executive board, and then it was unanimously adopted at the assembly at large. So this is how science diplomacy takes action to actually be an active change agent. It's sad that many of the decisions made do not take into account the best knowledge we have. We are probably making decisions from all knowledge. So that's what translational science does. So using the best evidence to help decision makers to make the best decisions for their people.
So Colombia played a significant role in getting the resolution through. What did Colombia do that other countries could replicate?
So they took this initiative very seriously, and they incorporated scientific advice from the beginning of the process. So everything had very robust evidence. So that evidence was unquestionable, and that built a solid foundation for the. But the second thing they did, they actually devised a diplomatic route map in which we navigated with the step-by-step. We started making side events, letters coming and going. There was even a retreat in Geneva for ministers of health months in advance of the executive board. So with the toolkit, we prepared material so they would deliver that to their peers. So we actually walked the talk in Geneva. It's a march that it happens the Sunday before the WHA starts every year. We walked the talk, we spoke to ministers of health or their delegates while we were walking through the streets of Geneva. And it was a whole advocacy work that made the resolution a green one. That was part of the things that Colombia did to make this a successful resolution in a record time, because it usually takes more years, and it was just 1 year.
What further action, we have the resolution now, what further action is needed to scale up fortification in Colombia and across the globe?
So I want to point out that having the resolution is not the end of the process. It's just the beginning, because now we are helping countries to adopt it, to implement it, to make a monitoring and surveillance system that this is actually happening, that the food industry is actually fortifying, and to make it sustainable in the long term. What's interesting is that many of the stakeholders are already embracing the initiative, and I want to talk about Millers for Nutrition. So after the resolution was passed at the WHA, there was this alliance, this consortium of the milling industry.
So this is the people that take the grains and grind them into flours or...
Yes. Yep. And the only thing that they have to do is to put the micronutrient mix into the product. And they decided to do fortification despite not being obliged to. So even if in the countries they're working, there isn't a legislation that makes mandatory the food fortification, they voluntarily are started to fortify three main foods. So it's rice, it's oil, and it's wheat flour. In 8 of the most populated countries of the world, that's 1/4 of the population.
Wow.
So they started doing that. And now they are protecting thousands of people. So the estimation, the expected impact of these initiatives is that we're going to have 200,000 less cases of neural tube defects, for example, and 60,000 less elective terminations of pregnancy because of this cause.
Wow, that's amazing.
What the dimension of it is that a very inexpensive measure is actually doing a huge impact. And I want to tell you, Paul, some important things about the resolution and the initiatives that came after that. Is that the WHO is not imposing this to the countries. The countries voluntarily decided to adopt this measure. And what's even more interesting is that they will decide, according to their local capacities, their anthropological, cultural, gastronomic context, they will decide which vehicles they're going to fortify.
So this is the foods that...
What are the foods that they are selecting for fortification?
Yeah.
Because for Colombia, we already had fortification of wheat flour, but most of the population eats corn-based products or rice, and we just updated and scaled up our resolution legislation to cover all of the three basic foods. So now, together with Costa Rica and the United States, we are championing food fortification to having the most complete legislation covering that. But for Brazil, it's probably cassava that they will fortify. For Ethiopia, it's probably naan or teff. That's what's even more remarkable from the resolution, that it left the room for autonomy for each country to decide how and which vehicles they will fortify. So that's excellent. And also, I'm proud that this initiative came from a low and middle income country, that it came from the neurosurgical side, taking the knowledge out of the OR, and also that it all started with a doctoral research in which the result is not in a repository, in a library, but it's actually making change in real life.
So in terms of the next steps around making this as impactful as possible, is there other things that can be focused on and done as well to increase the impact?
Well, definitely we need all the stakeholders to take part. So for the governments and legislators and decision makers, it's to actually promulgate and enforce the fortification laws, but also for the food industry is to abide by those laws, to actually make evident in the product that is being fortified. For the healthcare personnel, to continue creating awareness about micronutrient deficiencies, but also about fortification. For the consumers, to also be literate about their own health and nutrition, and see fortification as an aid to their well-being instead of something imposed, for instance. However, there are still some challenges. For instance, there are groups of people that have their own crops growing, and they eat only that, and that's not fortified. So how do we reach these populations? Because usually they are the most vulnerable. For instance, native populations. And there's an interesting initiative in the United States. So Mexican American women that live in ghettos, they have a very well-studied problem of acculturation. So at the same time that they don't speak the language, they don't eat the local products, they only eat, for instance, corn masa that they produce or they import, and that's not fortified. So although the United States fortifies rice, corn, wheat, etc., they don't eat the fortified food. So in 3 states, some members of GAPSB, especially from the University of Alabama, have made their state legislators to pass policies, and now they are fortifying the corn masa as well. So this specific vulnerable population that has a high incidence of micronutrient deficiencies now are getting protected.
I love the way that this is being targeted and also made culturally relevant to food groups and populations. And so it's a very targeted intervention, which is affordable, and governments and health professionals are joining together to really address it.
And I think it's essential that is culturally sensitive, because that way people and consumers can embrace the policy as something that is good for them and their families.
So one thing we like to close things with is a bit of a question that we can all relate to. Is there a food memory that has shaped who you are today?
Yeah, definitely the Lebanese food. I have a Lebanese background.
Okay.
So my family
Lebanese
migrated to Colombia.
Okay.
And we were living in a small town in the north coast of Colombia, and it was probably 2 or 3 Lebanese families there only. And they not only mixed very well with the local population, but they started bringing the Lebanese food as their contribution to the local gastronomy. So kafta is a specific way of preparing meat with spices and everything. And of course, kibbeh, tabbouleh, hummus. So nowadays, with an intercultural mixing, so those are local products for some places in the north coast of Colombia. So that's one of the memories, because I grew up eating Lebanese food in a very Colombian town, and having that mixture is a great memory. It's a great food memory. So everywhere I go and I see Lebanese food, it's always like going back home.
Amazing. Well, thank you, Dr. Kemel, for joining us on the show, and all the best for this week in Geneva. And we hope that there'll be continued progress to report on countries taking up fortification and really implementing it in the right ways.
Absolutely. Thank you. And also thank you for all the work that the chefs are doing worldwide, also to make better food for everyone.
Yeah, we need to all come together and do our part.
Definitely. Thank you so much.
Thank you.
You've been listening to Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. Future Fork is produced by Disruptive Consulting Solutions and supports the SDG2 Advocacy Hub. For more info, head to the website futureforkpodcast.com. This show was produced with strategy and production support from Wavelength Creative. So you don't miss an episode of Future Fork, make sure to subscribe to or follow the show in your podcast app. And while you're there, leave us a 5-star review. It really helps others find the show. I'm Paul Newnham, and I'll see you in the next episode.